So good afternoon, and thank you all for attending our discussion on understanding the basic needs of our students. So we've seen that the cost of student well-being and academic success, that students have been experiencing a need for basic needs, has become rising across the UC system. We believe that on-campus entities such as CAPS, student health, and case management services would benefit from becoming a little bit more culturally competent with these students to address the ones that are reporting unmet basic needs. According to a recent unmet basic needs report, students have reported sleeping in lounge spaces or with friends, showering in recreational facilities, skipping meals in order to buy books, intentionally seeking out student activities and programs where free food is provided, citing that they haven't eaten all day. Another study reported frequent mental distress that was more prevalent among students who have reported unmet basic needs versus those that haven't. We've also seen that an adding challenge would be the access to quality health care for our low-income students. The Global Food Initiative has ignited movements across all of our UC campuses to create programs and initiatives to meet the basic needs of our students. During this panel, we're hoping to discuss what some of these UC initiatives are, what are the gaps, and what can providers do to help. Before I jump into introducing our amazing panel, I'd like to just get a show of hands. Have any of you seen this as an increasing issue on your campus? Yeah, okay, great. Well, we're really excited to jump into this a little bit, so I'm going to take a moment to introduce our panelists. So I'm going to start with Dr. Karen Monero. She's a licensed clinical psychologist. She has over 13 years of service at UCLA and has spent the last 8 years in the role of case manager in the UCLA Dean of Students office. Dr. Monero has had many years of experience working with the undergraduate and graduate students from diverse, underrepresented, and vulnerable student populations. She's also one of the founding members of the UCLA Economic Crisis Response Team. Then we have Sharifa De La Cruz, who is the Economic Crisis Care Manager at UCLA. As a first-generation college student and immigrant, Sharifa's passion is supporting the success of those who are underrepresented and unheard. She has about 12 years of experience working with students from diverse, underserved, non-traditional, and low socioeconomic student populations. Then we have Lori Weiner, who is a licensed clinical social worker over at UCSD. She serves as a student affairs case manager. She coordinates support for the undergraduate students experiencing hardship due to unmet basic needs through case management, collaborating with UCSD staff and other campus resources. She's also a member of our UCSD Basic Needs Committee. And then we have, last but not least on the panel, Irma Murphy, who is also a licensed clinical social worker at CAPS. In this role, she offers clinical services to students by providing assessment, brief interventions, treatment planning, case management, referrals, and collaborative consultation and treatment support with campus partners as well as student affairs. And my name is Soraya Kamisa. I'm a social worker who also works with Lori as a student affairs case manager. So I also coordinate support for our students in terms of kind of keeping in mind what are some things that are going to help their well-being, enhance their experience. We do this by coordinating with both on and off campus providers and resources. So before we jump into some of our Q&A, I'd like to start out by showing you a video. It's a PBS news story that aired in October of 2016. It focuses on the basic needs of some of our UC students, specifically at UC Berkeley. Because we don't have a student on our panel, we thought it'd be really nice to show this video so that you'd be able to see a little bit of what the student experience is like before we talk about what we do as staff members at the university. So why don't we start?
Be surprised to hear that hunger and homelessness are growing problems for thousands of college students across this country, particularly among those who are the first in their families to pursue a degree. This is forcing some universities to figure out new ways of keeping low-income students in school. Jeffrey Brown has the story from the University of California, Berkeley, as part of our weekly education series, Making the Grade.
Oh, darn, these tortillas are not very good.
Every Sunday night, Anthony Carrasco prepares the food he'll eat for the week ahead, setting himself a quota of one meal a day.
I can, skip breakfast, skip lunch, even skip dinner, and I've just saved myself close to $30 or $40. I, like many folks, come to college to get out of poverty. Really thought that was the end of the line when we got the admission letter. Fortunately, it wasn't.
Anthony is a junior at the University of California, Berkeley, one of the nation's leading public universities. And he's the first in his family to attend college. It was hard to get in and now hard to stay in, but maybe not for a reason many people have considered.
You're expecting long nights in the libraries and tough exams, but what we're really facing is, just sleepless nights worrying about rent and really distracting lecture halls when you just can't stop thinking about food.
Today, almost a third of all students entering 2- and 4-year colleges are first generation. They're more likely to be minorities and come from low-income families. And by the estimate of one advocacy group, more than half of them lack reliable access to food, and that contributes to their lower graduation rates.
Many years ago, I myself was a student here at Berkeley. I was fortunate enough to have the means so I could concentrate on my studies, my grades, and yes, the fun side of college life. But more and more these days, many students find they have to worry about more basic needs, including food and shelter.
A beautiful campus, world-class academics, and now a new reality.
Is there any stock on Friday?
We're going to restock on Friday. So everything is going to be here on Friday.
A campus food pantry, where twice a month students can stock up on staples. The University of California system has worked hard to bring in first-generation, low-income, and what are called non-traditional students, such as veterans and those with families. But more work is required to help these students survive and graduate.
25 bags today, keeping on pace. Okay.
Ruben Canedo is a first-generation graduate from Berkeley. He's now a leading advocate for student food security and oversees the campus food pantry.
What we're doing on our campus is making sure that campus becomes basic needs secure. You have the recession, you have the increasing cost of living, and students are caught in the middle of that.
Do you see students falling through the cracks? Having to leave school?
Absolutely. We definitely have students that said, you know what, at this moment, I can't do this. And they left. Whatever you see in here. And it was not because of their academic challenges, it was because of the living cost of the area. They were saying, I can't afford my rent and I can't afford to eat, therefore I can't stay here.
Berkeley, sitting in the midst of the notoriously expensive San Francisco Bay Area, is among the most costly college towns in the country. Financial aid can cover tuition and books, but sometimes it's not enough for rent or food. And for some students, there are barriers beyond money.
When you get here, you're also coming into a higher level of academia that especially sometimes more non-traditional students are not used to.
TJ Dunavant is another first-generation student and a mother of 5. After serving in the Army Reserve, she decided to earn a degree, but she struggled to catch up to her classmates.
You're reading all new material that you're not familiar at all with, and so it takes a lot to be able to, get that in.
Have you had times where you think you couldn't get by, you might have to drop out of school?
Yes, when I don't understand exactly where to go to get the help, there are times like that. But now that I'm in my 3rd year, I know where to go to get the help.
How are you? I'm good. Good to see you. Come on in.
TJ regularly meets advisors at Berkeley's Educational Opportunities Program, a campus resource for disadvantaged students.
What's going on? How's the beginning of the semester been so far?
It hasn't been bad. I feel like I'm doing better at keeping up.
Yuki Burton is another Berkeley graduate who now works to help those who followed.
I have students who are living day by day, again in that surviving model, and thinking about how do I meet tomorrow's need, and not thinking about my long-term wellness. It's actually just earlier this morning, a student who told me they were skipping meals, and they didn't realize that they had been skipping meals until they verbalized it with me in a session.
Having talked to so many students and worked with them, what separates those who make it from those who don't?
Community and support. I think to some folks that sounds very trivial, right? Like it's not a concrete resource, but it's really having a group of peers, of staff, of faculty who understand my story and who get it, that they don't have to over-explain themselves.
The person that's experiencing these things might be sitting next to you in class and you might not even realize.
In her art class recently, Taylor Harvey told fellow students about her own plight. Taylor has worked since age 13 and spent parts of her youth in homeless shelters. She's experienced tough times in college as well.
I'd stay in a homeless shelter, but it's pretty unsafe for a young woman to stay in a homeless shelter. There are a number of students who sleep in their cars because it's cheaper. or sleep in university buildings, libraries, places that close at night because it's safer that way.
Taylor shares an apartment for now until school closes for holiday breaks or her financial aid is spent. And she's now trying to raise awareness on campus of the homeless problem.
We admit that we don't know what the solution will be, but we know what our end game is, and that's to eliminate student homelessness and to help first-generation college students stay in college and graduate.
This summer, the University of California system approved a new $3.3 million fund to help students access food on and off campus. The difficult situations many students find themselves in have forced Berkeley and other institutions to re-ask some basic questions.
If we are a public institution, what does it mean to educate the public? What does it mean to educate Californians? And what does it mean that education is an engine for social change?
Fabrizio Mejia is Assistant Vice Chancellor for Student Equity and Success at Berkeley.
What it means for our institution in particular in the UC system is that we have to invest in the programs that are going to welcome the students in, that are going to get them through, that are going to get them to succeed at the level that we say is required for everybody across the board.
As more first-generation students pursue degrees, colleges and universities will have to address the challenges these students bring with them. From Berkeley, California, I'm Jeffrey Brown for the PBS NewsHour.
So if any of you are interested in seeing this video, again, it's on pbs.org, and we'd be happy to share the link with you. Now that we have heard a little bit about what the student experience is like, we're going to jump in and talk about what UCLA and UCSD are doing to address some of these needs. So we're going to take some time, and I have some prepared questions for our panelists, and then I want you to know that at the end we will be taking questions from any of you, so feel free to, if something comes up, just maybe jot it down, and at the end we're going to do our best to address questions. We also have business cards at the back, so if we don't get to your questions, feel free to take our business cards and send any of us an email, and we'd be happy to get any information we can to you. So my first question is for Dr. Monero. Will you tell us about the development of the UCLA Economic Crisis Response Team and the way it was designed to reach vulnerable and underrepresented student populations? Furthermore, maybe a little bit more about your experience with students who have mental health concerns and who also are in a financial crisis.
Absolutely. So I know that, a lot of times we've had students in financial crisis over the years. I don't know if you can hear me.
Got me. Sorry.
Is this on? Can you hear me?
Switch it up again.
Oh, is that better?
There we go.
Okay, good. So, the term starving students is one that's used very often, but I'm sure you all remember that in 2007, 2008, the United States faced the greatest depression since the Depression in the 1930s. So, because the housing bubble burst, the stock market had a real downturn, there was a lot of unemployment, families lost their homes, et cetera, which you're all aware of, and it became a worldwide economic downturn. So our students were impacted with their families. And students either who had been receiving aid or some help from their families weren't getting it anymore, or then a lot of times even more students had to use their financial aid then to help their families instead of supporting themselves on campus. So we were very fortunate at UCLA to receive 2 large donations of money. And our Vice Chancellor of Student Affairs at the time, our former Vice Chancellor of Student Affairs, Yanina Montero, really had a vision and a passion for helping to address this need. And that money was used to start our meal voucher program at UCLA, and this was 7 years ago. And it was also used to have a nice fund to be able to provide students with very large, substantial short-term loans that were interest-free. They really ended up being advances on students' financial aid. So just one example of how that helps students to have, because prior to that we only had short-term loans that were like $200 or $350 at most. So that allowed us to be able to provide students with a good amount of money so that, let's say they had their rent due then we could prevent eviction by providing them with that short-term loan. So then our Vice Chancellor of Student Affairs pulled together our economic crisis response team. So in the beginning, in 2009, she really handpicked representatives from departments in a very intentional way. So not only did she have representatives from financial aid, from student loan services, student accounting, et cetera, and housing, but she also brought staff members from other departments that that were servicing students who were in the most vulnerable populations, and the underrepresented populations. So she had representatives from the Academic Advancement Program, the Community Programs Office, and the Bruin Resource Center from the very beginning, which serves our former foster youth population, veterans, transfer students, students with dependents, and what's that? I think there's one more. And now actually that department works with students that have substance dependence issues. So from the beginning, and they also included me on the team in 2009 as a case manager. So I think our Dean of Students and our Vice Chancellor of Student Affairs really had some foresight into the fact that a lot of these students are struggling with mental health diagnoses as well as financial crises. Then over the years, it's really expanded. It's gone from 14 members to 27 members. And we've added other departments who have membership on our team, such as the LGBT Resource Center, our International Student Center, and our Center for Accessible Education, which used to be called our Office for Students with Disabilities. So we are able to come together and over the years really been able to make some huge changes in the way that protocols and procedures are run. So things that they've always done a certain way, sometimes we're really having a negative impact on our students within financial aid, within student loan services, or other departments. So imagine all of us sitting around a table and we are talking about students and the struggles that they're experiencing. And for all of us, for me, it was a real learning experience, and it has been, and it continues to be, into what are some of the limitations and federal regulations and things that prevent our financial aid office from, let's say, increasing a budget for a student or otherwise. Why do they do the things that they do? Because sometimes it seems so frustrating and incomprehensible. So we were able, as student affairs professionals working with these vulnerable populations, to be able to have some insight into why these rules exist and why they do what they do. And on the other side, it has been such a great collaboration and education and a development of cultural competency for our financial aid staff members, our student loan services staff members, our housing staff members, to be able to really get to know, like, what are our students experiencing? You know, why do they end up not being able to live within their budget every quarter? You know, what is going on? So to be able to share with them in a way, we can't share diagnoses, and we be very careful about privacy, but to be able to share in some ways what they're telling us about what they're experiencing. So, and with regard to housing, it took many years for us, but we were able to develop a protocol and procedure and an agreement with housing so that they are providing us with emergency housing in the residence halls and also in university apartments. So that was many years in development, but I think it was also this development of relationships and trust on that committee. We meet twice a month. And developing that trust has really brought us so far in being able to have these collaborations. Housing's made, well, Sharifa will talk more about this too, I'm sure, but Housing has made an agreement with us that they'll charge only $25 a day, and our economic crisis response team pays for that for the students. And it's a 14-day maximum. So during that time, we're able to work out the financial crisis that the student may be experiencing and hopefully be able to get them additional funding and find them a more permanent place to live. I'm probably running out of time, but we also have, the other part of the question was about, what about students with mental health diagnoses as well as financial crises? So what we've seen over the years is that, we needed to be careful with regard to students with substance dependence, that we're giving out very large short-term loans. And we realized very early on with one particular case that I can remember, that we really had to be careful because they weren't sharing that information with us. I'm a case manager. I'm not a clinician in a HIPAA-protected environment. I do obviously, follow FERPA, but they weren't sharing that with us. But then CAPS knew that information. So CAPS, couldn't share with us either, but I think, sometimes we're very concerned about what we were doing on the team regarding that. So that was one issue. And then, of course, students who may have ADHD, they may have a trauma history, and mental health diagnoses obviously get in the way of students being able, their symptoms get in the way of them being able to function well oftentimes. So that means not managing money well, potentially. Maybe a student has a manic episode, maybe spending a lot of money, the substance dependence issues. So we were seeing all of this as a lot of challenges that students were having and being able to maintain with their budget. So, I was thinking about what are the things as mental health professionals that we tell our students to do to take care of their well-being. We say self-care, 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 right? So if a student doesn't have money, what's one of the things we tell them to do? Eat well, right? But what if they have to skip meals because they don't have money to pay for it? What if they're eating eating ramen every day, so they're not getting the nutritional benefits? And we always tell them to sleep enough and to sleep well. Well, what if they don't have a permanent place to live? What if there's couch surfing? And another basic need is just safety. Do they have a safe place to go to at the end of the day? And especially for those students who have PTSD or trauma histories, how is that affecting them? Are they re-triggered? Are they re-traumatized? Are they students that are couch surfing or sleeping in their cars are more vulnerable to assault and theft of their personal belongings as well? And then the other issue with regard to mental health survivors or those with mental health diagnoses, trauma survivors, et cetera, is we tell them, follow your treatment plan, right? That's what we tell them to get better. What if they don't have transportation to get to their treatment provider because they don't have money to pay for the bus? What if they don't have the money to pay for co-pays for their medication? What if they don't have money for the co-pays for their therapy sessions? So those are all some of the things that I was thinking about when talking about that question. So
thank you, Karen. Mm-hmm. So my next question is for Sharifa. Sharifa, would you be able to tell us a little bit about the centralized initiatives of UCLA's Economic Crisis Response Team? What's the process? What are some of the interventions and resources that you all offer?
Of course. Good morning or afternoon. It's afternoon, right?
It's afternoon.
So first, Karen's touched on many things that the Economic Crisis Response Team does because we sit around the same table. I care manage the financial piece of the Economic Crisis Response Team and essentially coordinate the entire team. Our process is based on referral. And before I go on, I just wanted to mention that we do have our Economic Crisis Response Team referral card on the back table, where you can take a look and see what it looks like. But essentially, we distribute these among our campus partners and place them strategically in areas of the campus where we have in the past seen students that might have this need, might frequent. So students will generally either email us, we have an email that goes to the entire committee, or a faculty member, staff member, or anyone in the campus community can refer the student to our team. Once we receive that first initial referral, I will then reach out to the student and essentially do an intake or an assessment to get a better sense of what the student's needs are. And to, Karen's discussion earlier when she was talking about all of the things that might impact students in being able to be successful if basic needs are not met, these are the conversations that we initially have when we perform the assessment, is what is the immediate crisis, and then how do we get that issue addressed and then move on and counsel the student and connect them with resources in a way that they can be self-sufficient, with an ultimate goal of getting them to graduation. So one of the very positive things of our team is we've established and developed this very wide campus partnerships and collaborations, which really allows us to provide realistic solutions to students from the time that they see us all the way to graduation. And many times we have followed students from their entrance to the university all the way to graduation. So process is assessment, and then once we make an assessment of what's going on with the student, then we decide as a group what our recommendations are and what our interventions are and what resources are available. In many situations, because we are a decentralized campus, it's a matter of getting the student connected to resources that already exist and helping them navigate all of those resources, like the financial aid office, housing, student accounts, working through holds, working through payment plans, and many other things. And because we have such a wide representation on campus, we are able to successfully solve problems without necessarily providing direct resources such as a short-term loan or any other sort of funding. We also work very closely with the financial aid office, and actually part of my position is in the financial aid office, because that is a very important partnership, because we do need to adhere to all of the federal regulations, state regulations, as far as the dissemination of resources is concerned. And if you are familiar, the cost of education is a big thing in any school, anywhere that the student goes. So we really have to adhere to those guidelines and coordinate with the financial aid office to make sure that the student is not only accessing all of their resources, but that they are living, in a sense, within their means. As part of that, we've also developed a financial wellness program, which is sort of our preventative initiative on campus to educate students, empower them to be able to manage money better so that they do not end up with the economic crisis response team. So the team is really a response, and then the financial wellness program we have on campus is the preventative piece to minimize the referrals that come into our team. The other thing that I want to mention as part of our work is advocacy. This is the majority of our work, and that's really rethinking policies that we, on the university level, have the ability to address. As Karen mentioned, many times things are just not working for students and they keep hitting a wall. And because while we do maintain confidentiality, we do track trends in terms of why are the students coming to us. And eventually we identify trends in which we can see, well, there's a set of students that continues coming to us because of this particular reason. Why is this happening, and is this a policy that we might be able to do something about? And a lot of times we are able to work with our campus partners to not only make exceptions, but to really rethink a policy as a whole on the entire campus. How am I doing on time?
You're good. Got
Okay.
about, yeah.
Good. And then I wanted to mention the direct resources. Karen touched on a few of them. We provide emergency housing, which is a partnership that we have with the housing office. We do pay for the students up to 14 days at $25 per day. And this is specifically for students that have nowhere to go. During that time, during those 14 days, we're working with the student on a long-term solution. And this is a very important piece of the process, because we don't want the student after 14 days to be back in their car or on the street. Many of these students end up being, domestic abuse victims, or, a variety of reasons that I'm sure all of you have heard from students as you have worked with them. One of the other direct resources we provide is the Chancellor's Grant, which is the funding that Karen mentioned earlier. Is part of that funding that we received from the Chancellor is to essentially provide students with Chancellor's Grant funding if other resources have been exhausted, while at the same time coordinating with the financial aid office to make sure that they are not exceeding their needs. The other thing that Karen mentioned was the short-term loan program, which is, a 30-day interest-free short-term loan, and we probably issued these days, like one a day. And it's usually for, immediate expenses, rent, preventing eviction, food, and many times it's an advance against aid that they anticipate, but it's just not getting here in time. For example, during this time of the year, this happens a lot where students the financial aid won't disperse until like the 4th or 5th of January and end up in their hands, but their rent is due on January 1st. So this is the time of the year where we generally will see a lot of students come to us and ask for an advance. Then we have the meal voucher program, which is also funded by the funding we received from the Chancellor's office, but we also have a partnership with the Swipes for Hunger student group. And they have actually, over the last 3 years, every quarter they have a drive, and then they donate those swipes to us, which are then converted into meals that we can issue to students. Like basically it's a meal ticket, and we have campus partners on campus that distribute these to students that come forward with basic food needs.
I think if it's okay, I think we
Yes,
might move
we're
on to
good.
our next question.
Yes, I got it.
So my
Covered
next
it all.
question, sorry, Sharifa.
No.
So my next question is for Lori. Lori, would you be able to tell us about some of the UCSD initiatives to address basic needs issues?
Sure. Can everybody hear me? Oh, I just turned it on. Can you hear me? Is that a yes?
You need to pull it closer, yeah.
All right. I thought I have a very loud voice. How about now? No?
It's not loud, that's what it's.
Okay, but it's okay. We're good. Okay. So at UCSD, I'm a student affairs case manager, and part of my job is I am on the Basic Needs Committee. It is very different from the ECRT. We actually had the chance to visit last week and observe the UCLA ECRT, and it was really amazing to watch that process. Our Basic Needs Committee is an interdisciplinary or multidisciplinary committee. We meet once a month. So examples of people on the committee are myself as a student affairs case manager, one of the deans of student affairs, associated students, housing and dining services, student legal services. We have at least one professor as well who's on our committee. We meet monthly, and we mostly just discuss campus initiatives regarding basic needs issues, and we also work really closely with the associated students. And so we also have students that are part of the committee as well. One of the first things that came out of that was almost 2 years ago, so January, almost 2 years ago, our food pantry was open. So I know now most, if not all, UCs have food pantries on their campuses. At the time, I actually had just started, I think maybe 2 weeks before that, and I'm a social worker by background, so I was so excited to see a food pantry on the campus. And it's in the process of expanding actually at this point. And we're seeing hundreds of students using it every week, from undergrad to grad students. Another thing that actually came out of that and also kind of out of the food pantry is we have food vouchers for students. So myself, Soraya, and the deans, and then also actually at the food pantry, we all have some on our person. They're very small food vouchers. They're $10 per voucher. But if we're sitting with a student and we know that their stomach is growling, and I ask them if they're hungry, or if I know that they're really struggling financially, I can just give them the voucher and let them know, hey, this is at least one meal. And we're actually working on a system of maybe getting larger vouchers for students. Probably not, probably not more than $50, but I do believe that we're working on another food, a bigger food voucher system. Something else that came out of the Basic Needs Committee is I was part of a small subcommittee, and we are coming up also with an emergency temporary housing policy. And I think probably because of UCLA's policy and other campuses' policies, we came up with ours pretty quickly. It was pretty amazing. Within maybe a month to 2 months, the policy was put together. I'm trying to think when our first meeting was, but probably the end of the summer. And I believe that the policy is going to be put into place at the end of January. So it's going to be, again, pretty similar to the UCLA housing policy, emergency housing policy, where it will be about $25 a day for students. There will also be a possibility for, but not mandated, food option on there, where they would also get dining, either dining dollars or something like that. And actually up to 60 days, which is pretty amazing. The hope is that within that 60 days, or less, that students will be working with either their case managers or a basic needs coordinator, who I'll talk about in a second, who will help them figure out a longer term plan. But we're really excited about that. I know that this fall in particular, when school started, I don't know how other campuses felt, but within the first 2 weeks to month, I met with quite a few students that got to campus and didn't have a place to live. And so this would have been extremely helpful for these students. So another thing that we're doing is we are hiring a basic needs coordinator. That person will be on the case management team, but they will also work closely with associated students, and they will be located in the food pantry area. So we're expanding the food pantry and also expanding that whole area, and it will be a full-on office for the basic needs coordinator. And I believe that the basic needs coordinator will also be working with, probably more closely with financial aid than we do. But speaking of financial aid, a lot of the time, there's two different things. One is we also have a basic needs loan that also went into place, would you say last school year? Was it this
Yeah, it was
year?
last academic year.
Okay. Where if students have basic needs and they present either to us as the case managers, or if they present to the deans as having, basic needs, needing extra financial support, then we can then refer them over to financial aid, who will then kind of sit down with them and figure out if they qualify for a basic needs loan or a basic needs grant. And that's been really, really helpful for students this quarter. And then just kind of on the level of being a case manager, we often will get referrals from the deans of student affairs when a student needs support regarding basic needs issues. And so as a case manager, we often will then call up financial aid with the student in the office, and or before and or after, and talk about grants, and have financial aid talk about grants or loans that the students might be able to get regarding mental health services, because a lot of our students don't feel like they have the money to go into an intensive outpatient program, for example. They're not cheap, even with their UCSD SHIP insurance. Or a student has Medi-Cal, or they have UCSD SHIP insurance, but they don't feel like they can pay once a week their copay for therapy, plus once every couple weeks or once a month for their psychiatry. So we always talk to them about financial aid and how financial aid might be able to help them out with grants and loans, and we connect them that way, which is going to segue into our next question, I believe.
Yeah, that's actually perfect. Thank you for that. So my next question is for Irma. Irma, would you be able to tell us how healthcare access affects the well-being and academic success of our students? And additionally, is student health insurance such as SHIP enough, or are there barriers to accessing healthcare?
Sure. So just kind of laying a little foundation. I'm new to the UC. I'm really happy to be here. I've been here for about 6 months and came from CSU San Diego State, and we actually modeled our ECRT team after UCLA because, of course, we found the same issues at the CSU that we're seeing throughout the state. So I've been, working on these same issues for a number of years, and I think out of the stressors that these students are experiencing, stressors for not having the basic needs or previous trauma or whatever that is, comes the issue of their mental health, anxiety, depression, trauma-related conditions coming up. And oftentimes they have to make those choices between, do I survive by getting the basic things like food or paying for rent, or like Lori and others have said, Dr. Moreno mentioned it, pay the copay, despite having very good insurance that may be paid for under the guise of their financial aid. They're having to make those choices of whether to take care of themselves by accessing the resources that they have for mental health or medical versus feeding themselves. So that's often the struggle that I see with students, and usually it's affording the copay. Transportation is a huge issue, getting to where they need to be. Getting out of bed, they're so depressed, getting out of bed and getting to their appointments and navigating that system that might be very new to them. They might be seeking out services for the first time because they're available to them. And so those are all kind of challenges to the access that they might have. And Lori touched on access to healthcare. So most of the UCs do require that students get health insurance. Coming from the CSU, I loved hearing that because the CSU does not require students to have health insurance, and that was even more challenging to work with, but the UCs do. But even with that, the student may still not be able to afford their copay or insurance. I'm finding that students that waive out of the school health insurance are either they have Medi-Cal or they might have a parent's plan. They might have something through Covered California, and that might be a very affordable health plan. However, the deductible might be too high, or their copay is $30 instead of $10. And so all those things are additional barriers where they have to make those choices. Do I eat for this week, or do I pay my copay? Or not understanding their health insurance at all. They don't know how it works. I think one of the biggest challenges that I've seen with access to healthcare has been our students that come in with Medi-Cal. Is everyone familiar with Medi-Cal? It is a nightmare. Although it's insurance, and I always kind of spin it on the positive side that this is healthcare coverage, the access to it is very, very limited. The care itself is fragmented. They're lucky if they see their therapist once a month. And depending on where your university is, the providers that accept those particular health plans are not in the vicinity. They are several miles away and may not have appointments for 3, 6, 8 weeks out. And so that continues to be a challenge. And we often talk about the resources that are available at UCSD where they can get a grant to help pay for their insurance. Even that is difficult because they're going to have to forego their plan. They might have to give up that Medi-Cal to get the SHIP, and that's something that is sometimes difficult for them to manage, especially if it's going to affect the family household. So those are all increasing challenges that I see all the time. And these are folks that really need these services because their stress levels are, their anxiety, their depression, they have such a gamut of issues that they would really benefit from, but they're constantly having to weigh in on basic things like food and shelter. And usually the mental health piece falls way down in their priority. As far as the other question about SHIP. So SHIP is our student health insurance program. I don't know what it's called at other UCs. So as mentioned before, they may have SHIP, but not having transportation to those providers around the community is a challenge. And again, those copays. And sometimes with those health plans, there's an additional, it might be an 80-20 or it might be a 90-10. And so that percentage that is their part of the bill is something that simply can't be managed. So even if they have the best of the health care plans, that copay is something that could be a real barrier for them. Let's see, something else. I think the other piece is with some of these resources that are out there that are supportive to students, just navigating the social systems that we have in place is very complex. There's a lot involved. They have to be very persistent. And that's just difficult to do when they're full-time students. They're trying to survive. They're dealing with stress and depression or other issues that they might be experiencing. And having to navigate those systems on top of it can be really distressing and overwhelming. So again, so thankful for the case managers that partner with us and help those students navigate those systems to get what they need, because they're out there. There's a lot of really great community resource available to students. It's just a matter of educating them on how to utilize them, how to get connected, and advocacy is huge because we have to advocate for our students in connecting them with those resources because they're not often able to express the need because it's just too much, or the need is greater than they can verbalize to that other person on the other line. So.
Great, thank you, Irma. So we have a little bit less than 10 minutes left. I had some other questions, but I'd love to actually put it back out there and see if you all have any questions that have come out of their answers and give you all some time to do that. Does anybody have any questions or comments right now? Yes.
How many of the services that the panel has discussed is relevant to our grad students and can access those services?
I can take this one here. For the resources that the ECRT team provides, it's across the board for all of the UCLA students. Obviously, there are different eligibility requirements because of their support they receive from their departments or graduate division, but anything that our undergrad students are eligible for, so are our graduate students.
Great. Any other questions?
Recording this session, so if you could share with us.
Thanks so much. Tim Galarno, UC Santa Cruz. Just thank you all for bringing the intersections of basic needs and issues that are under the Dean of the Student's Office, but not necessarily part of the clinical case working support model, because I think what the PBS NewsHour has started to hint at is there's a larger crisis that's a canary, and that really leads to structural inequality and poverty. And the idea that what that sad restrictive position noted in PBS is that it's low-income first-generation students when the data across the UC system is showing right now, according to 2016 UQ's and Graduate Wellbeing Study, that I think it's 80,000 undergrads and 12,000 graduate students are low to very low in food insecurity, with the largest sample globally in the history of college food insecurity being undertaken with our IRAP division here. And so students are coming in, and not just small pockets of first-gen students, but by and large with a lot less in their pocket due to the cost of attendance. And so the problem solving has to bridge between those and clinical supportive models with policy advocacy, researchers, and advocates. And so I'd just love to put it to the panel, what excites you the most about advocacy and policy, and where do you want to jump into that ring?
Advocacy and for our team, I think the most exciting part about the advocacy and the policy and the things that happen on our campus is that we really are able to take each case in a very wholesome, holistic way and tailor an individualized response to the student and really take them from A to Z. And I think that as this issue evolves, based on this, the trends that I've seen and the experiences that the students have described and their realities, I think that that is something that is the future of this work, is to partner with our colleagues and our campus resources and our experts wherever it is that you sit, and be able to respond in a very holistic way, because students are not only, experiencing all of these mental health issues and academic issues, bouncing from one place to another alone and not understanding policies just adds to everything that they are already facing. And I think it's up to us on each campus to try to mainstream and kind of develop more of a flow and process where it's easier for the student to navigate all of these resources, and we're the ones that can collectively provide that response. So that's exciting to me, very exciting, because it's already happening on our campus, and we've seen it to be very effective for students that experience a wide range of challenges.
And I just want to piggyback also on that. In terms of the Basic Needs Committee on our campus, that's kind of my little piece of working on advocacy and policy, because I think that on a daily basis, for us, the two case managers currently on the campus, we are just so busy trying to piece things together for the students all the time that we don't even get to that advocacy piece. So that's my, once a month, I get to put my 2 cents in of what I'm seeing on the campus regarding basic needs issues. But also making sure that people around the campus are starting to know more and more about what their resources are. So people that, everybody on campus, I think that's one of the points we really wanted to make today too, was making sure no matter who you are on the campus, that you know what the resources are. If there's a food pantry on the campus, know about it, know about how to refer students to it. If there's financial aid support that can help support students with basic needs, to also know about that. Talk to the case managers on your campus to see if they have more information regarding those types of things, so that you can give that information to students when maybe your student isn't going to get to a case manager, for example. And then another thing that we've also done, which you see, we've got UCLA and UCSD up here, but we all of the UCs connect on a monthly basis. And we actually, on an annual basis, have a kind of a conference meeting. We actually hosted this year at UCSD, but one of our breakout sessions was to discuss this very issue. And so it was so helpful to hear what all of the different campuses were doing on basic needs issues, just from, up here on the advocacy and policy level, but also down here on what are the case managers, what are different people on the campus is doing with specific students. And we've been able to, kind of start modeling on different campuses and calling on different campuses to see, what are you doing that's working, what are you doing that's not working? And then bringing that to our basic needs committees or things such as that.
We have a question over here.
Yeah.
Myra Howard from UC Santa Barbara. But I went to UC San Diego, great campus. I'm going to play devil's advocate. People come out of college sometimes with incredible debt. They come out with a 1.3 GPA. There's a lot of, is this the appropriateness for the person, rather than trying to keep them in there, creating debt, creating anxiety? Is there any counseling? Is there any suggestion, career counseling, that something may not be right, even if they are the first member from their family going to college? The pressure from that is so hard for some of the young people I see. They do great. They go back to community college, come back to us with direction, with goal, and without the big debt. Do you deal with that at all?
I would say, yeah, I think that's a really good question. And I think oftentimes we, on our economic crisis response team, really try to take the time with the students to kind of do an overview of what are their goals, to look at choices that they're making. And we've talked about in other sessions, in the former foster youth session, we were talking about how sometimes it would be in their best interest to take a break. So we do try to counsel them in that sense, and you know that maybe there would be a better time in their lives to be coming back. And I think especially for students that really may be symptomatic and having mental health issues at that time, maybe having a mental health crisis, to try to talk to them about what are some alternatives, you know, maybe moving home, you know, getting some of their units in the community college, saving money that way. So I think we try to really maybe sometimes get together with parent and the student along with financial aid and academic counseling, sometimes to do that sort of reality check for the student as well, and to talk about these are options, these are not options. And it's really helpful to have a parent in there as well if we can. So I think that's a very good point to make, especially about the amount of debt that our students are in. And I think there is a time and place for students to take a good break and to get treatment that they need and maybe be at home where there's more support.
Karen, I just want to add that that was a discussion we had at the last case managers meeting. I don't know who was there at the UC, and I think it's a very difficult discussion to have with a student in the reality that you're not getting ahead in a sense because of the situation. And it is a very difficult discussion to have with students that a timeout may be the best answer at the point. It's not, you know, drop out of school, but rather a timeout. And I think that is difficult to do, but with the support of a plan that we're here to help you, that, you know, there are resources out there that will get you to a better place. But I just want to acknowledge that that is difficult discussion, and that is something that I know that the UC case managers have brought up before.
So we're actually out of time already, and I know some of you had some questions back there. I saw some hands. So if you'd like to come up and ask us, we can hang out for a few minutes. We also have our business cards on the back table. Feel free to take those and email any of us, and we'll do our best to answer as many questions as we can. Thank you.
Thank you.
Thank you.